Hello, everyone. My name is Senator Marie Alvarado Gill, and as we observe Mental Health Awareness Month, I am honored to share with you an important initiative. The Assyrian Wellness Collaborative, in partnership with Stanislaus County Behavioral Health Recovery Services, Prevention and Early Intervention, is steadfast in its commitment to reducing the stigma of mental health and raising awareness of the significance of well-being in the Assyrian community. Their approach emphasizes cultural competency and sensitivity to guarantee access to care is available when needed. The hope is to identify these barriers and work together to create meaningful solutions to serve individuals who are at risk of serious mental health issues and their families as well. Thank you for your participation and willingness to make a positive difference in our community.
She was my mom. The legacy that she left me was a lifelong love. My mother had dementia. When you reach a point in life where your loved one has reached that stage, in my case, a 95-year-old mother, that you need to turn someplace. And it's wonderful that there is a place to turn to, and that is a place like Bristol Hospice.
The staff with Bristol Hospice are angels. They're very caring, loving individuals that care about your loved one.
Having been a nurse for over 20 years, I've had a lot of different experiences. I've worked the acute, I've worked skilled nursing, and of course hospice. Being chosen to be involved in someone's care during their last days, for me, there's no bigger honor.
Without hospice, I would have been lost. It was a trying experience to begin with. The journey with hospice was very positive. You felt like you had a support group and you had all these people to take care of your loved one.
My husband, Paul Leonardo, passed away after about a 3-year battle with cancer. I knew my daughters and I wanted grief counseling, so I found it at Bristol. And it has completely changed my life. It is exactly what I needed.
My name is Audrey. Art passed away in March of 2013. Then I found myself being very sad. I called, made a reservation, and it was just the best thing I've ever had. People were so professional and so loving. I mean, it was a personal thing. Great opportunity to heal. And that's basically what our loved one would like, is for us to heal.
I would definitely recommend Bristol Hospice. I had the ability to take care of my mom at her latter stage of her life, and that was a real blessing. She'll always be my mom. I love her then, and I love her today.
شامل هون گشکان مغبه پرجان مغبه أنا إيفان جانا أتانوس ودي بتاعك يبتفتح هون كمثل كما دقيقة يخادك ترابا شابرتا خاخور زرابا شابيرتلن خادك ترابا بريشتا خزيتونن قد شمو إلى بريستول هاسبس هجتت أديو خجة شاتوني لا خجة ياكورتا هجتي لا إنه بخشابن رابان كيت لكت كلن ميدالا يلبخ وبزبط ملبخ كخاك دوخينا رابا بغدان كدو دي لختيتن بدابي مني خابر سبتكت إلى جورتا دا هاسبس مدخلنا الشمو وبزي خاجبين كأطورايا اتجانن عزيزة كت خارتا من دون بتهمزمن Hello dear, my name is Janet Atanous and I would like to welcome you from Assyrian Wellness Collaborative. Please introduce yourself to our audience so we can start asking you some questions.
Thank you. Thank you for having me. My name is Brigitte Lee.
Okay.
And I am the Executive Director of Bristol Hospice here in Modesto.
Okay.
Yeah. So our company has been here at least, I would say about 10 years. And I have been with this company about 3 years. So our service is really the goal of care is really to provide care for patients who have terminal illness and
Okay.
keep them comfortable at home,
Okay.
a nursing facility, or assisted living care. So all kind of venue.
Okay, wonderful. We have never talked about the end of life, and in my opinion, it's a very important subject to talk about and to be familiar with the end of life and the choices that we make for our loved ones or ourselves. So I'm very, very pleased to come here. You have a wonderful facility in here. I've never heard about the facility because I live in Turlock. But it's a blessing that we have such place for our loved ones. If there is a need that will exist, one way or another, we all gonna end up somehow at the end of life that we need to be aware. So our goal is from Assyrian Wellness Collaborative to learn and to teach the members of our community that there are choices and there are places that are available for our loved ones when the time exists. So I really, truly appreciate that. If you want to give me, in conclusion, a few other words of wisdom that you have, we would greatly appreciate that. And then I will speak with Johny in Assyrian.
Okay. So as we say, the end of life, the discussion of end of life is never easy. Who can coping with death and dying? It's very difficult for all of us. So we have a group of nurses, chaplain, social worker, CNA, and when we provide care, we just not only provide not only physical but also emotional support,
Right.
Spiritual support, because ultimately, at the end of everyone's life, what do we have left? We have only faith, right? And that is something that's going to help us go through the journey, not alone, but with someone else that helping us, that be there for us. So hospice services, I think is a great service. And I think it's a blessing that this country offers this service to everyone, and it's for free. And so,
It is for free.
It's for free. It doesn't cost you anything.
Wow.
And so, and you get all of the support from all level, and you have nurses, stand by 24/7 for you. You have a doctor also stand by 24/7 for you, and social worker and chaplain, clergy. You have all kind of discipline that's always available for you 24/7. It's a wonderful service, and I cannot say enough of this.
I really appreciate that because I believe that the end of life is integrity, compassion, kindness, and understanding.
Yes.
Just as you mentioned, because it's so difficult for someone to go through this process, but it's something that we were all born one day, and one day we have to leave this world.
Yes.
And what a blessing it is that you have mentioned you have chaplaincy and the care of nurses. I highly respect all the nurses because I worked in surgery myself for surgical prep for 30 years. So I'm very aware of that. But it's a blessing to have this much care to be given at the end of life to anyone who is in need of it.
Yeah.
So again, I feel that it's honor for us to have met you, and hopefully, if there is any need for us, or if we have any loved ones that are that have the need to be contacted or to be brought to your facility, we will contact you, and then we can together share this love and kindness and compassion and try to make it easy for the family.
Yeah.
My husband, Paul Leonardo, passed away after about a 3-year battle with cancer. I knew my daughters and I wanted grief counseling, so I found it at Bristol. and it has completely changed my life. It is exactly what I needed.
اشتعملوا خون جشكانة برجانو مغربي مدري أنا بن جانا أتانوس بتاعك جبت فتو خون قمت خد كما دقيقة هرت خد كم تهم زملي لشان الإنجليز من خامتة كديبة Executive Director of Bristol Hospice أدي بين هم زمن مخاج بنك أطورايا قد لخف الخانة لي آمن كديان بيا بالكمانو هار بدا دكتة بين قبل نفشين عزيزي جوني بيتسايد رابا بشنتيت رابا بغداين بتفكت ديوخ شافهورن بديوخ عزيزي خواهش فادن خدش بودجانو همزم بودا دكتة همزم Bristol Hospice packet.
Bristol Hospice, yes. نطلع شنو الأخ بالخانن.
Okay.
أيضا بابي شيل مرايا جانو راب من يعني الأخ ببان مويا. الأخ بدأ إيكا شارخ و كل إن خبرانة كديان راب خبرانة جورفا. شو نعمل باليابا. بلاخ من ناشه خارطة very good داشولا. قد كم سنة كناشه مخيانا حيرة. هذه كد رابط سباي ليبون. يعني تخمون مخراب سباي ريسورس. كناشه جانا. بدأ إنك دراب ناشه قدام مني جانا إينا. كده situation.
هل هجت قد باسو همزومخ إلى خدش ياكرتا. But the end of life. We're speaking about the end of life. خيك مدان I appreciate ملت دي أن رابط شاتون إلى قابل قبل خلا خبر سوبر مريالة خنا practice خينا. إتها مو بتودخ مو جرك يودخ مو كماسة ودخ. إني أنا بقريات رابط أنا كاينة. قد خيك مدان أي ألن رابط خالصة ليتخ من ماي بقرا ميك هايرتا طالبخ. یم بلکه خشوه حیارتان ایلا من خپنتا. اینه هرت خد بدایتون سوگلی پرجان مغرب خورس دیان همه شبیه لکت اخرن جانن بلیابخ خارتا بایر ملپخ که هدامت امتن. یتبری شاید هرت خد مری آمندی هجت خچی یاکرتلا. ادن خانشم رایلک قد بدایخ یعنی خانه چارا لیتن. أنا شاب ين أبرسوبتا برسوبا بدمنيخي. إتخب جابو خرجتن زوزي رابع عن كاينة قد بتاينا. خانا شد برشلة جو هاسبس جو هاسبيتالز حكيمة بيت قرباي تشمشتا. إني ناش اسن رابع ألان بتلاكلا ألان تالوكو جانا. إني بيان تيان كد لا ألان لا تلك خج دختاني خج سبرخ سلطة صالح رابع بغداين كد جدا أطرب بخايخ على هبورخاني لجاني جان رابع مديانة تنجدا أطرب الكيجو أطرباتت كد إخرن بريخ جابتيخ لتن خامنداني دكتور كد بالخانت compassion دختاني integrity help كومد بيتانت قارت رابا أنكيت لكد هيفي لتلن البات أرا إن إتن برسوبي كد كماسي كد ينهايري أرخاز أخلا ميدالر خاش فادن همزم بودا kindness كد إخلوهن إتلوخن همزم مجرك شارخ خا برسوبا بمريا how did they contact you financially, physically? What are the situations and how to go about that? Please.
Yeah, Rabas by question ila. Kisharia idan family accept vadona kad
Kabulona.
Dus kabulona kad anasha labuluk maraskhana in a bitayle midde bedarich maraskhana. Hebrishlich bitayich. Dumanan in a placha. Bush raba problem baila in a raba solution litlan. ناشد أنت معنا مودة خلق بيها مشابخ يمارس خانة أنا شد رابط تخبرتو رابط لجيبتها.
أوكي.
أيضا مطايتون أدو جيدة قد لك بداخلنا مو عادات أي لدانة هاسبس. هاسبس أيضا تبدأت يا جيبتها و ناشا بتخبراله. CNAs بشادري. CNAs كده ناشا بلكي طلع جاي شبتها خمسة جرى شبتها. كده باسوبر خابي. ماتي شيف دودي توبرياته انميانه كدرابه ياكويرنا على كلبات
خدامة كلبات شو
دوس ورابطك انتجريتي لما خيانه خمرخ جور لا بيا بخت خلاله كلبات لا بيا جور خلا انميانه
يعني there's a sexuality كبرونا لمس كيما ايدا ماخه ين بخلتها همزومة غنا this is reality ين دايبر شخلب هرت خيان خبرات لمصال متيال بابو هي انخبتها جابوتن so that's wonderful كده خنون اتلقون resource كده كماسيتون شجيتون لبيتا packet
yeah تاتخ بيتا so the idea إلى جان كد بخ بيتا ودخل كمد كربد مرسخانة كد كمسخ
اوكي
قرابات بشادرخ انا من يعني كد لازم ويلتشير اكسجين درمانه CNA بدات يا هرمك هوسبيتال بدات يا بتمزالة patient دازا خارت النيرس بدات يا nurse بدات يا درمانانه prescribe دودا train دودا على family مو ديتون in between visits and then اخن لخ القدمه مو ديتون 24/7 number بيا ميخا emergency فيلا قاريتون كديان لوكو ياكا hospice company شادي خا nurse ميجيب دازيتون مرس خانه بلاله so رابع خامويلا patient بيتا ورا مطايله الو خارت درامنيان سباي social worker يابنا
okay
ايو social worker رابع سبايلا because I don't hire like a family can then about benefits اديا IHSS hours
اوكي اي رابع انكيت هلا سب رابع من أمتن كامي أباهاتي ين نانون تسابونت لون جبيتا ماشنت لون ين خلاش مرانت لون إتلون صات من IHSS إتا لباي أني صات كتيلون سب that's really financially that's very important كحكمة كالبتة أديه دان إخرون عتيتون مسألة شرخ لا أورقيو هاسبس ديوخون مو كويا بعدز إن أنا تيبورن كبابي إتلي 50 ساعة IHSS إذن هاسبس بتاعي بيتها خنا أنا أشولا لم بعدو إخنون أشولا بعدتون كبابي أي مجربة إلى أي هاك دي بتكالي يعني هاك أنا بشكلني
IHSS hours كله إنا ديوخن أخن شولتنا in fact أخن بجربك social worker ما سكلنا hours possibly كم شيء شكلي كرب ترمو 8 طلا أدخل كربة
واو ساعته
ترمو 8 طلا ساعته يرخرا وناش بشكلنا أتشا خرط بلاشنا بشكلنا إمو تلاي أربعة خدشة مزيودة أنا كدمان you know the national violence hospice تخبرتو بشرابة بايلة
دوزيلس 24/7
okay سعدي بشرابة caregiving ميخ so IHSS hours هجدان إذا لا مخا خلا
that's wonderful
out of pocket lit كfamilies
okay
I don't actually medical medicare social worker بجارة شولة زارزلة
okay
so
يعني خنا خرج لتن additional خرج قد hospice يبخ
من جيبة لتن
no بس in parsupat قدت لون Medicare and Medi-Cal they qualify for hospice care دوزي لا
well everybody insurance wise qualify KOD if clinically qualify OD
I see
so if at clinically even hospice appropriate add on to shulanak zerzi
oh okay
automatically depending on company لما ذاك company you know Bristol but dying no out of pocket أنا لين خزي خانة خشب باسوبا من جيبو باره
but it's clinically you have the patient has to be clinically qualified for hospice care
Robust
way and that includes at any age
yes any age Rob a good question
مثلا accident villa catastrophic accident
دوزيلا
يالا براتارك من 15-year-old you know 10-year-old
كويا كمان أجهزة تدلبة إلك دي عندك الأخي كبلخخ إنك يخزخون من يانا إلك أيضا خناشة clinically إتلا under 6 months less of life
I see
رابع إتلان patients قد 14 من نانينا
really
because cute 6 months كده revisit أودخ إن عنا بوش خربة فيله كامس بايش and same إله كامس بايش you know have a bus باي فيها right أيضا تلالي لازم hospice إن خك بدنا شيء كابي maintain هذا دكتور كطلع 14 خدشناش أسرة ديكه
yes
ككلك شخلبها
yes
in qualified EVIT as long as qualified EVIT تدابت all hospice services
and in hospice care you gamarani كابيتون oxygen to be kept alive
yes ma'am yeah كودخ مودي لازمية إلى so Robert great question بقولك hospital bed wheelchair walker over bed table oxygen درمانانة supplies and briefs بالفاشنة
of course
and رابط family problem هنا
yes
ديمانة دينا
رابط ديمانة
وشخلبته رابط الزحمة ديلا so سبايلا دن خناش بيتايل بعده لك كلبات كم سويا كلبات أخن كم سخ أبخ clinical
of course
you know you do your job أخن ودخ our job وك integrity patient رابط راح ديلا
دوزي لسبخك من إن حالا دختاني موخي بالخانة they are still with us انخبتأتن ملت ديال كجناجة بلا اللي بيخ انخبتو يا نارها تبرية بالكلبت إن راو بغداين جاني جان قد أتمن دوز على برخاني اللي كت بكلم بيدارو سبب أهرابا أن انكيتلا هلت خدمري ناشلة بدا مبتت بيشن يخيوتن إن لخا راو بغداين كت بكلن داخل organ donation خجة باسو همزم سب أنا جاني كلبتي كل إيفر organ donors أي دخا هجت رابا ياكرت لك ملتديان في الشيء ملتديان to be able to say I'm an organ donor إن بداين غزيتم بين دجاني كما أنكيت لك ما يعني بركات لدن خانش من يوخله هدامت بارو بشي دويخه ك 8 أسرة برسو بخينة إتلن من كوسا هير من عينة من كيدنيز من lungs من heart رابع مديانة تنكت كم سامة جلدة سبانا جمانا سبانا ديان burn patients yes أني كل بركاتنا إذا خانشة من يوخله تشاتوني لك أمتديان تانا أخن لا بايخ إذا ما خغال بارو أني مديانة شكل خلون إن هرديدان كت برسوبة خايلة إخلن كماسخ أني مديانة هدامت بارو شكل خلون هلبتا من جو hospital جو hospice تودير من يعني كد أبي for organ donations هيج كده من دياتن فيت كد كلبتا من دي كوبلونا بيدونا
إذن دانت admission بعدوخ أني كل من يعني باكوننا باكري ناس بيعرف full code يا DNR أي رابع important topic إلا
yes
إذن ناس يدي دانا بارنا رابع ناس معنا نو بياخدك resuscitation full code يعني كم سخ سيفو دخ
شو مد لازم يلو أودخ كمارانا كد باش خايا
إنا also بيخ explain أودخ كاته because I didn't give you example خناش رابع frail إلا
yes
okay كل بيت imagine إلا
CPR
بالكد لا the best idea كدوناشا
جرم بشمتي ما خغل صدره
ورابع أجزانت اللي بقي لك family إذا بغزاينه وناشا بار resuscitation
of course
so enemy يعني educate دخلون كاته كد لاخشي تاني yes because they think it's the right thing to do they have to be educated خارت رابع ناشا change كودي so we'll talk about مخمرخ donor enemy يعني we'll talk about DNR full code so family can make organized decision we support donors because خزيخ miracles
yes it is a miracle
and it's like anasha munichle ina khanasha khina rushle
khanasha khina bkha 8 anasha khina kam si khayla
so there's a blessing you kulamindi
yes wow
ina sama zoda hayarta ila kay nasha yanan bayin yati kat it hayarta o pride and min yana metakhum merza raba hayarta it kay nasha yanan
ala barik له Johny John this is a wonderful topic سبانا جاني من رابع كاشهم زمتن كاش أمريكا بزب كاشة من تدجانن قد أمن دي ليلة خلطة ليلة خطيتها خكرا معنا our community it's a faith-based community أطراية
big time
البل لا خطيتها لا وشو لا دخله على بريان دي جاري هرتها يعني أزخ إنه أو من دي أنا لم بخشى خطيتها من كاش تكتون زمتن absolutely not because you're giving a gift of life هرتخت blood donation with your blood you can save so many lives so definitely هم بركاتنا من على أخلن كابولخ هم ده بركاتنا كد كما صغير بخلون كشبت من ياجنا خيني كد إن بي أبي organ donors إن را بغداين كد أدلخ إيفد عزيزي مجرد كماسي نأمتن إن على لابد خامندي تيلي خزاجة تيلي and there is a need that it comes into existence. How do we contact you?
Directly. أنا همش a personal cell phone دي كذا.
كوي نخاني ختاني تلفونه.
Yeah. 209-596-5066.
رابط باي أي تلفون إيدوخي لا يعني همش هبتو يا منو خنا.
السيار باشا.
Yes. شمو إيلي؟
Johny Beitsayad.
Johny Beitsayad. بس لا مخبليتون سجولي. Rawa Bagdain again, Shavhuran Bidiyuch. Honestly, I am really blessed to have met you.
You too.
Because Edan Gani Yuda field even, I know how it is. It's time for compassion, again, integrity, kindness, help. Help قد خكبنا شلي ماسي بقري يمكن أخبي إن قدام من دي على هبرياني لك كلن خايفخ كلن سنيك دام من دي بخ هريت خدانا همش من خاتي كارمن كوين هم زمتا أزستي وديولا مصلوية منن إن بالخانة ديان إلى جانا يلبخ خرطة ملبخ and it's at no cost.
I love it.
Yes. مدري أبيتم باسيمة برجانة مغبة كشكانة مغبة كد شريك لوخن منن كدا خرزة رابا شابيرة خا خرزة كد رابا منتيانا إلي ديش دي مويلة منتيانا كد إذن خايت خمندي كبوملا هرت خمري على برخاني اللي قدات رابا خايخ اتخدو كنانة تن كد كماسخ آتر خيارتا طلبخ هرب ديدانا إذن خا برسوبت عزيزا هدامت كلبت من يوخلي قد أرخاتي تن كماسخ هدامت باغران دو خخلون كبرسو بخينه بس عبيتون مدري روا باسيمي كجيشك توخون ماشمه توخون عزيزي اتلوخ مديان خارطة قد بايد تانت in closing do you have anything to add in English as well?
Yeah, it's kind of
Please.
misconception about hospice.
Please.
Yeah, thank you.
Sure.
Hospice ila aggressive pain management. That's
Okay.
it. The job is to keep patients out of the hospital for something the hospital can no longer treat.
Okay.
Another thing is أخنلي بخدرمانا قد rush عدد transition process.
Okay.
ولا شكل خدرمانا من patients قد خاموية alive.
I see.
So a misconception قد hospice إلى مخ pulling the wire.
He.
لا a time of death is between you and God. أخن we don't mess with that.
Okay.
أخن all we want to do is keep you comfortable between now and that time.
It's comfort care.
That's
all
it.
the way to the end.
That's it. Nothing more, nothing less.
Okay.
Okay.
Well, Abidra Basima again.
Thank you.
Khaltala, we will meet you again.
Yes.
And if there is a need, we will call you. Abidra Basima Azizi, Allah Barakhlo.
Thank you for opening
Thank you
your
so
platform.
much.
Thank you so much.
Abitun Basima, Gishkan Mugabe, Khaltala Tabkar Biokhon, Yuhurzet Khinik Tabilan. Pusham Shana.
She was my mom. The legacy that she left me was a lifelong love. My mother had dementia. When you reach a point in life where your loved one has reached that stage, in my case, a 95-year-old mother, that you need to turn someplace. And it's wonderful that there is a place to turn to, and that is a place like Bristol Hospice.
The staff with Bristol Hospice are angels. They're very caring, loving individuals that care about your loved one.
Having been a nurse for over 20 years, I've had a lot of different experiences. I've worked the acute, I've worked skilled nursing, and of course hospice. Being chosen to be involved in someone's care during their last days, for me, there's no bigger honor.
Without hospice, I would have been lost. It was a trying experience to begin with. The journey with hospice was very positive. You felt like you had a support group and you had all these people to take care of your loved one.
My husband, Paul Leonardo, passed away after about a 3-year battle with cancer. I knew my daughters and I wanted grief counseling, so I found it at Bristol. And it has completely changed my life. It is exactly what I needed.
My name is Audrey. Art passed away in March of 2013. Then I found myself being very sad. I called, made a reservation, and it was just the best thing I've ever had. People were so professional and so loving. I mean, it was a personal thing. Great opportunity to heal. And that's basically what our loved one would like, is for us to heal.
I would definitely recommend Bristol Hospice. I had the ability to take care of my mom at her latter stage of her life, and that was a real blessing. She'll always be my mom. I love her then and I love her today.